I am Dr. Derek Beyer, OBGYN at Grand Itasca. I see all women patients from just beyond pediatrics all the way to geriatric female patients for problems including obstetrical care, gynecologic issues, pelvic support problems, urinary incontinence, many other things in the like, and including well woman care. Prenatal care basically is in the initial stages of pregnancy, identifying that there is in fact a pregnancy, that it's just one fetus to begin with, identifying risk factors for the mom to determine if it's just a routine pregnancy or if there's a high-risk pregnancy involved. Early on, it's useful for lifestyle modification, like quitting smoking, avoiding drugs and alcohol, talking about routine screening for genetic disorders, appropriate weight gain in pregnancy, safety issues, all those sorts of things to begin with. The second part of pregnancy is basically watching for preterm labor and establishing that the pregnancy is growing according to plan, performing an ultrasound in the middle of the pregnancy to look for any congenital problems that the baby could possibly have. And then towards the end of pregnancy, watching for things like gestational diabetes to make sure that the mother isn't glucose intolerant, which can increase some risks for the baby and the mom. And watching mom's blood pressure to watch for things like preeclampsia or hypertension in pregnancy that could be more problematic for mom if it's not addressed. So the initial visit is usually established around 8 weeks of pregnancy, and then we see patients on a monthly basis up through about 32 weeks, and then typically every other week until 36 weeks, and then usually every week until the baby's born after that. That timing of prenatal care is important, basically to watch for those sorts of complications that can occur, and sometimes they can happen quickly, and that keeps us on top of things so that we get a good outcome for mom and baby. Things that are important in pregnancy that the mother can actually do to impact the pregnancy is being careful what you put in your body. So again, avoiding drugs, alcohol, tobacco. Basically also staying active. Maternal activity, when you stay active and exercise during pregnancy, it's actually a good thing. It helps limit weight gain and actually reduces mom's risk for high blood pressure and diabetes during the pregnancy. And moms that are more on the fit side do well with labor also. So those are kind of the basic things. In addition, prenatal vitamins are helpful in preventing things like anemia during pregnancy and actually can prevent spina bifida if you're taking folic acid. DHA is an important supplement also for fetal brain development and can also be involved in helping keep mom's mood healthy. So lots of things moms can do to have a healthy baby, healthy pregnancy. Activities during pregnancy that you may want to avoid, anything that could cause trauma to the baby or to your abdomen. Proper positioning of the seatbelt while you're in the car is important so that the belt's over your hips and the shoulder harness goes down between the breasts and off to the side so that there's no belt or harness over the abdomen. But basically anything that could involve trauma to the mom's body is probably best avoided. Things that I often get asked about include like water skiing, riding horses during pregnancy, motorcycle. I tend to ask people to avoid those things just to prevent the possibility of trauma. So things in pregnancy that you may want to let your doctor know about. The common things in the first part of pregnancy, bleeding and cramping for the possibility of an early miscarriage or even real early labor. It's important to bring that to your doctor's attention if that's going on. The day and age we live in, COVID symptoms are something you want to report if you're feeling feverish, chest pain, shortness of breath. Bring that to your provider's attention and get screened appropriately. In the middle of pregnancy, really signs of preterm labor again, regular contractions, bleeding or leaking fluid vaginally. And then as the pregnancy advances, a decrease in fetal movement would be things that you want to bring to your doctor's attention. Grand Itasca Clinic and Hospital, your partner in health.